Ziprasidone, brand name Geodon, is a name for an atypical antipsychotic drug that is used to treat a variety of mental and mood disorders such as schizophrenia and bipolar disorder. It works by blocking the action of dopamine and serotonin, two neurotransmitters in the brain that play a role in regulating mood, behavior, and thought. The starting dose of ziprasidone for the treatment of schizophrenia is typically 20 mg twice daily, with a maximum dose of 100 mg twice a day. The starting dose for the treatment of bipolar disorder is typically 40 mg twice daily. Doses may be adjusted based on the patient's response and tolerance to the drug. Like all antipsychotic drugs, ziprasidone can cause side effects, including drowsiness, weight gain, dizziness, headache, tremors, and restlessness. In some patients, ziprasidone can also cause more serious side effects, such as increased heart rate, prolonged QT interval on electrocardiogram (ECG), and increased risk of developing blood clots. Ziprasidone is contraindicated in patients with a history of allergies or hypersensitivity to the drug, and in patients with certain medical conditions, such as a prolonged QT interval on ECG. The recommended laboratory test before starting ziprasidone include complete blood count, CBC, liver function tests, LFTs, kidney function tests, KFTs, fasting glucose, A1C, lipid profile, ECG, electrolyte levels, and thyroid function tests, TFTs. It is also recommended to monitor for changes in weight and blood pressure. It is also important to review the patient's medical history, including any pre-existing conditions and any current medications they are taking. There is a warning issued by the United States Food and Drug Administration, FDA, regarding the risk of mortality in elderly patients with dementia-related psychosis who are treated with antipsychotics. The warning states that these drugs have been associated with an increased risk of death in elderly patients with dementia-related psychosis compared to those who do not take the drugs. It is important for patients and healthcare providers to be aware of this warning and weigh the potential benefits and risks of treatment before starting or continuing therapy with ziprasidone.